Joining me now is author Michael Rosen, who was hospitalised for a long time with COVID-19 and also suffers from long COVID. Michael, it's good to see you, and I mean that literally. How are you these days?
I'm good, thanks. Yes, I'm enjoying the weather here, as you can see.
Yes, it's certainly a nice day out there. It lends itself to reflecting on what's happened over the past 5 years, and what a 5 years it's been.
Yes, it's affected millions of people, people bereaved, people of all ages who died and all ages who've been affected by COVID. So, yes, there's plenty for many, many people to be thinking about today, yes.
It affected so many people in so many different ways. Of course, we all know someone who was really badly affected by COVID, whereas for plenty of other people, it was no more than a sniffle that happened a couple of times. For you, it was genuinely terrible. You were in an enforced coma for weeks, it turns out. What do you remember of that time, both before and after, and in terms of the care that you received, Michael?
The care was amazing. The last thing I remember was a doctor standing by my bed and saying, would I sign a piece of paper that would allow them to put me to sleep? And I said, will I wake up? And they said, you've got a 50-50 chance. And I said, what if I don't sign? And they said, 0. So I signed. And then I don't know anything at all for about 45, 46 days. And then the first thing I remember was a nurse by the side of my bed saying, you're on puree. It says so over your bed. And I tried to look round and I couldn't. And she said, what do you want? And I said, what have you got? And she said, shepherd's pie. And I said, oh, well, I'll have that. And then she said, can you feed yourself? And I tried to lift my arms up and I couldn't. And I said, this is amazing. This is wonderful. And I think she thought I was taking the mickey. And I said, oh, no, it's amazing. And thanks for feeding me. And she said, well, it is my job. So anyway, that was in between there. I was about 42 days in a coma and without memory. And the doctors thought that I was brain dead because this eye, left eye, wasn't working and I wasn't reacting to noises on my left side because it knocked my left ear out. I had micro bleeds in my brain and blood clots in my pulmonary artery, the lungs, the big artery that is in there. So I was, badly affected.
It's being marked up and down the country today. I know you're speaking there at the National Memorial Arboretum as well. When you talk to people, Michael, about what you experienced, what kind of reaction do you get? Because I get the sense a lot of people feel it's like a distant memory, a bad dream. They want to move on and look forward with their lives. Whereas clearly people like you who are affected deeply by it and those who suffer from long COVID too are still having to live with the consequences.
Yes, people are very generous to me, and they say things like, you're alive, and they say it with a kind of mixture of kind of gratitude and amazement, and I say, yes, I am, look, it's a kind of spoiler alert to the plot line, really. But people are affected in many, many ways, and I see sadness. I was at a book festival, and a person came up to me, and they gripped the table and said, I've got long COVID, and they said, I can't, this is the most I can do, which was to come to an evening do. It's the most I can do. And the look on their face, there was a shadow across their face as to how bereft they felt about their own lives, that they'd lost the life they had before, and they had this complete exhaustion, which luckily I haven't had. I've had the other things, but not that sense of complete exhaustion that you can't get out of bed, or if you do, you're then completely smashed for the rest of the day. And I saw it on this person's face, and it's actually touched me ever since, actually.
Michael, just to finish off there, you mentioned that person saying, well, it's just their job to give you that food. But that says it all, really, doesn't it? We were out there banging pots and pans and clapping for NHS workers. Do you think that goodwill continues? Or do you think people need to be reminded that there are those putting themselves in harm's way for the rest of us?
Yes, we must remember. We must remember, every day they're saving lives. And as you've just said, they're putting their own lives on the line and did. We forget health workers died during the pandemic. Some of them at the very beginning when there wasn't enough PPE or the wrong PPE. I remember seeing, just before I went under, a nurse, and she was wearing some kind of strange improvised mask. You know, people just improvised with bin bags. And these were lethal in some respects because they weren't virus-proof at the end of the day, and they were in a situation in which the viral load was huge. So they were more exposed than people who, say, were walking about or, you know, or even on buses, say. And again, as I mentioned, buses, bus drivers. There was a real spike in deaths for bus drivers because they weren't protected. And so one person after another was getting on the buses, asking for their fares, paying their fares and so on. And they were getting the viral load, and some of them died. I remember that too.
Michael, it's great of you to join us. It's the weather looks like it's going to be kind for today's memorials up and down the country. I know you're speaking at them. And if I also may say, it's a good day for a bear hunt too, isn't it? So maybe that can happen later on.
It is, and an Arsenal hunt too.
OK. Michael, thank you very much indeed.